Hi guys. I'm just gonna make this as short and sweet as possible. I'm going to upload this to YouTube later. Right now YouTube is not working, so I figured I would just do it on Facebook and then I will upload on YouTube later when it allows me. So basically, I know a lot of you guys have been seeing me post things like I can't have caffeine, or how I have to keep my sugar and fat grams under 10 grams a meal, and my protein of 10 grams or more. But some days I post that I'm having a coffee, which obviously has caffeine, and then everyone is asking me, why are you having caffeine? I thought you said you can't have it. Or people are asking me why my doctor is telling me I can't have caffeine and all this stuff. So this is a pretty big announcement, and I don't know if you guys can tell, but my face is really red right now because I'm so nervous. Like, I'm about to cry, just because I'm, like, terrified of judgment right now. So I know people are going to have their opinions, and this is a big thing for me to say. I was going to just keep it a secret and not tell anybody, but upon going to therapy, they have stated, like, you need to have a support system, and you need to have your friends support you, but they also said that you will lose friends because they won't understand. I am not pregnant. Actually, I won't be able to be pregnant for like 2 to 3 years once I announce this. So anyway, as many know, like, I am a plus size girl. I am bigger, and I have struggled with my weight for a long time. I've had amazing results with things I've done. Like, I work out and I have amazing progress with working out. I do my Advocare stuff and I have progress with that. But at the end of the day, I still struggle with getting the scale to go down and getting my clothes size to go down. And there was a breaking point where I was just sitting on my bed crying and nothing fit, or I didn't feel comfortable or anything, and I didn't want to go out with my family. So I just, like, something has to change, which is when I started working out and watching what I'm eating, and I've been doing everything correctly, and I've been going to the doctor, and they cannot figure out why I'm not losing weight. They're like, you're taking the right supplements, you're doing the right exercises, you're eating the right things, because they have me track my food. Like, I have to write down everything, including grams and sugar and fat and everything. So they just can't figure it out. Like, they say my thyroid's normal. I mean, I could definitely eat better than what I do, they say. Like, I don't eat perfect. But anyway, I'm so nervous. This is a big deal. My boyfriend supports me 100% in my decision. And I don't know if, like, my mom or my dad or my sister, they're, like, the only ones that really know right now. I don't really know if they know how big this is, so they're just like, yeah, it's great, but, like, I don't think they really get the gist of it. So basically, December will make my 4th month of appointments. I have started the process to have weight loss surgery. That's my big announcement. I have decided to have weight loss surgery. It is a big step, like, drastically life-changing step. The doctors and the psychologist and the nutritionist, they are working with me to know that, like, it's a big deal. Basically, I'm not having gastric bypass, because with gastric bypass, what they do is they take a part of your stomach out, and then they take your intestine and reroute it to the new stomach. And they said that there's been some complications with gastric bypass. So for me, I'm having what's called vertical sleeve surgery, VSG. What that is they just cut a portion of your stomach out and make your stomach smaller. So they'll be making my stomach the size of a banana, meaning I will only be able to eat a half a cup to a cup of food a meal. Also, with any kind of weight loss surgery, there's a lot of symptoms that come with it. So, like, the reason why I have to have 10 grams or less of sugar is because all that sugar can cause you to have something called dumping syndrome, which is like vomiting and like the chills and the shakes and stuff. It just makes you really sick if you have too much sugar, because your stomach's so small it can't process the sugar. So that's why I have to keep my sugar under 10 grams. I can't have caffeine after surgery. They said possibly just for a while. I can maybe have it again later, but that's because the caffeine irritates your stomach, and with the surgery, since they're literally cutting it and stapling it and gluing it and sewing it, they don't want the caffeine to irritate the wound, so they want me off of caffeine before surgery, which is why they're telling me, like, go ahead and wean yourself off of it now. Also with this, they have me go through a bunch of testing, so I had to have like an ultrasound on my gallbladder, my liver, all my organs, a CAT scan, all these things, and my ultrasound revealed that I have fat growing on my liver, so fatty liver, meaning like if that fat continues to build up on my liver, it can cause kidney failure. So the only solution is weight loss, which I have been doing everything they've been telling me to do to lose weight, and I'm not. So that's why I have decided to go forward with weight loss surgery. And I know that there's risk and complications to any surgery, and it's very nerve-wracking because like I can't have rice after surgery because it'll swell, and with your stomach being so small, they don't want food that swells because it will swell up and make your stomach big again, so you don't want your stomach to stretch back out. I have talked to other people on social media, like on Instagram. I follow some other people who've had the vertical sleeve surgery, weight loss surgery, and asked them, and they say that they're able to have coffee, they're able to have toast, but not just bread, like they have to toast the bread and make it crunchy, that they can have a little bit of rice, but not a lot of rice, so it's just like kind of portion control on the rice, but I'm gonna post a picture when I'm done in the comments of what the surgery will look like on my stomach, like how they do it, because there's 3 different surgeries. There's the band, there's a band that they tie around your stomach, and then there's the bypass, and then there's the vertical sleeve. And the difference is with the band, it's literally a band that wraps around, and then there's a pump. And they said with that one, it has the most most unsuccessful rates because the band can slip and fall, or the pump quits working and then they have to go back in and do it again. And then with the gastric bypass, with them having to reroute the intestine up to a new stomach, they've had a lot of failure with that because it causes issues with digestion and going to the bathroom. So with the vertical sleeve, they said so far, like, they've had the best results because it's literally just been making your stomach smaller, and the part of the stomach that they are cutting out is the part that makes you feel hunger. So like you really won't feel hunger, which will help me because I have binge eating issues, so that will help me with my binge eating issues. And they want me to have a lot of protein because like to keep my muscle up, and all of that. So basically they're just going to do, I think if I remember correctly from the diagram, it's 3 let me see if I can say it, laparoscopic holes, like kind of like a Y, that they'll go in, and it's all done by camera, where he like cuts it and then he has to like sew it and then glue it and then stitch it, I think. So the surgery itself, he said, would be like 45 minutes, which to me seems crazy. And then I go to another room for like 2 hours, and then to recovery for 2 hours, and then it's a 3 to 4 day hospital stay. And right now, like, I'm in psychiatric, like with a counselor. They want to make sure that I'm like emotionally stable enough. I'm also in nutritionist classes, so I have to like meet with a nutritionist once a month, track all my food, because they want to make sure that like I know what I'm getting into, that like I can't have this surgery and still eat a whole piece, like a whole large pizza, or I can't go to Chipotle and eat a whole Chipotle bowl. And what's crazy is along this, so December will make my 4th month of appointments, which means I have two months left after December. They want me to really pay attention to the sugar. So I love orange juice. Aldi sells this mango orange juice, and 8 ounces is one serving. Y'all, it has 22 grams of sugar. I was blown away because I kept telling my nutritionist, like, yeah, I wake up every morning and have a glass of orange juice. And she was like, oh, how much sugar does it have? I'm like, oh, I don't know, it can't be that bad. Well, I turned it around, and it's 22 grams of sugar for 8 ounces. And, like, that doesn't include whatever food I'm eating. So my grams has to be 10 grams or less of sugar per meal. And I'm also not allowed to drink before a meal or with a meal. I have to wait 30 to 45 minutes after my meal to drink. So that's been challenging because I'm the kind of person that likes to drink with my meal. Also, crazy, milk has 12 grams of sugar, and I love milk. So I've been finding alternatives. Like, there's a brand called Fairlife milk that has 6 grams of sugar. So I've been like just finding alternatives. Like with ketchup, I've gotten sugar-free ketchup, and there's like a barbecue that's a sugar-free barbecue. So just finding small little things to like swap out. Crazy enough, almond milk has 15 grams of sugar. It's crazy. Yeah, so that's my big announcement. They did tell me that once I have the surgery, it is not recommended to have a baby for 2 to 3 years, like not to get pregnant, basically. Once I have the surgery, they recommend not getting pregnant for 2 to 3 years, just because they want you to heal properly. They want you to get your weight loss optimized, and they want to get like your vitamin deficiencies normal so you can properly carry a baby healthy once you're pregnant. So you can get pregnant and carry a healthy baby after weight loss surgery. They say many patients get pregnant and have healthy pregnancies and healthy babies. As far as eating lesser amounts, it works out perfectly fine. Baby doesn't get affected. Like, you still get all your food in and everything. So I've been reassured that like I can still get pregnant and I can still have a baby, because that was one thing I was worried about, was like, oh, if I have this surgery, can I not have a baby? And they're like, no, you can still get pregnant. So Mark and I talked it over, and we were like, well, we want to wait till Coraline's like 5 or 6, just because I want to wait until she's like out of diapers, till she's sleeping better, until she can help me. I didn't want her and like a sibling to be too far apart, but I wanted it to be to where she's like kind of more independent and less dependent on me. So that'll be perfect. I don't have a date for my surgery. All I know is I have to go through 6 months of these classes, and December is the 4th month, so I should be finished in February. And then I'm assuming that the surgery will be like March, April, May. I don't know. We'll see. I don't know how far they book. So I definitely will keep you guys as updated as I possibly can. I just have been really skeptical about telling the world. Like I said, I was just going to have the surgery and not tell anybody. Just because I've seen other weight loss accounts where people are like, oh, you took the easy way out, or you didn't put work in. And that's definitely not the case. It's not the easy way out, because you have to put work in to lose the weight even with the surgery. You give up a lot to be able to lose the weight, and you have to be disciplined and dedicated, and it's not easy. So and I definitely put the work in. I work out every day. I watch what I eat. I write everything down. Even on days where, like, just now we went out to Mexican, I still am mindful of what I'm eating and putting in my body, because I have to track it and write it down. So, yeah, that's basically why you've seen on my Instagram stories where I'm like, oh, I can't have caffeine, but I'm having coffee today. It's not that I can't have it yet, like, not really. They want me to, like, gradually cut it out to where I'm not having any. But once surgery's here, then I won't be able to have it for a little while. And then just alternatives like pizza. They said thin and crispy crust is better for you after surgery because it doesn't expand as much. So yeah, that's basically it. I love all of your guys' supportive comments. Like, I'm trying to not read them and be distracted, but I want to say thank you. I'm glad I said laparoscopic correctly. I love you, Jasmine. Thanks for supporting me. I saw somebody else say Lynette Moore. Is that how you say your name? You said that you've had it. did you have, I'm trying to read, did you have the sleeve or did you have bypass? Which one did you have? And then someone else said they had bypass. Okay, so it was you, Lynette. You had bypass in 2005. Wow, so there's a lot of people on my Facebook that have had it, and I had no idea. You guys, that's so cool. Well, that means that you guys can help me along the way. That would be great. So I'm going to, the reason for me doing this is I want to look back in like a year or 2 or 3 and like see my progress. I want to like track my progress by YouTube videos of like what I'm doing day to day, like what I eat, like after surgery, like what I would have ate before surgery and what I eat after surgery, and then track my progress with it, just because I feel like with the surgery I need to take full advantage of it because it's not going to be easy, and I'm doing this for a reason. I'm doing this to be healthier and happier. I want to be healthier for my daughter when she wants to play outside. I don't want to be miserable. I don't want to be like out of breath, and I just want to be happier. Like, I don't want her to see me crying because I can't fit into clothes. Like, I want to walk into a store and be like, I'm a size 7 and fit into a size 7, versus now I walk into a store and I'm like a size 18, but in some stores a size 18 is like a size 20 and they don't have that, so it's like hard to find clothes. So that's my announcement. But I am going to hop off of here and go watch a Christmas movie and then enjoy Thanksgiving tomorrow, because that's something else I've been nervous about is after surgery, how is Thanksgiving and Christmas going to be for me? Because I won't be able to just like eat a whole 2 or 3 plates of food, which is way too much, but like we all do it. So I'm like nervous about how the holidays will be after it. So I said tomorrow I'm going to try to be mindful of what I'm eating and how much I'm eating, because I know after surgery I won't be able to like eat everything. So I kind of want to train myself ahead of time. But yeah, so I'm going to go. Thank you guys. I love you all.